So in 2007, the National Asthma Education Prevention Program came out with the Expert Panel Report 3 guidelines, which was an update to their asthma guidelines. And we published a survey at our institution, which is the Nationwide Children's Hospital in Columbus, Ohio, to evaluate the perceptions of asthma management and the referral habits of primary care pediatricians in asthmatic children. Our survey was actually sent out to 80 pediatricians within our academic institution who are also academic pediatricians and take part in the residency training program. We sent it out to a total of 80 pediatricians and had a response rate of about 35%. Overall, in our survey, we found that less than 50% of the pediatricians were utilizing the guidelines. So we feel that there's a lot of room for improvement. And one of the biggest hindrances that the pediatricians reported to us was that they felt that they had a lack of resources and time available in their very busy practices to care for these very complex asthmatic patients. So one of our take-home messages was that we feel allergists can play a very important role in the evaluation and management of pediatric patients with asthma. One of the first areas that we talked about was in medicinal treatment. So inhaled corticosteroids are the first line of therapy for persistent asthma, and we found that around 60% were prescribing this medication. Pediatricians who weren't prescribing inhaled steroids were either uncomfortable doing so or unable to identify which patients would benefit from steroids. I think steroids, historically, being an immunosuppressive medication, people may feel a little uncomfortable prescribing them, especially in kids, but they're relatively safe medications when given in the inhaled form. So when parents come to us with the same sort of concern, I think education and a lot of counseling, kind of helps put those concerns at ease. The guidelines recommend referral to an asthma specialist, so that would be either a pulmonologist or an allergist. And I think where we can play a role is in allergy testing, because a lot of these children have allergic rhinitis, and comorbidities such as allergic rhinitis have shown to exacerbate asthma as well. So controlling other risk factors which contribute to asthma can help in overall asthma control.